3 days, we have seen a spike in number of positive cases being reported on the ICMR and also in the Health Ministry. To talk to us on this, we have the senior scientist from ICMR, Dr. Raman Gangakhedkar. Sir, thank you for your time. What is that we are witnessing right now? We have seen a sudden spike in last 3 days. Yesterday, sir, 89 new cases. How do you see this?
Now, there is one thing which I must say. We should not overinterpret numbers now, because numbers can increase if my number of sites where people can do tests also increase. So numbers have no meaning. Now, if you had lockdown yesterday and it continues for another 2 days, you will find numbers will be lesser, because people could not go, and people, even contact tracing may go down to some extent because there are no vehicles on the road. We don't know where people are. So all these numbers are going to vary because of different issues. More than numbers, what is essential is we need to know which stage we are in.
Which stage we are in right now?
We still don't have sufficient evidence to say that we have reached the community transmission stage. But when you take precautions, you assume that community transmission is occurring. You assume that I have to maintain good social distance because I don't know whether the next person who's standing ahead of me could be infected. If I do that with abundant precaution, I might find that we may reduce the spread of infection within next 2 to 3 weeks.
Another question on the testing abilities. We had the two big machines where the testing was to take place. What is happening on that front, sir?
No, that will happen. Essentially, you have to realize that by March end, those will be up and running. But you have to understand we are still consuming 10% of our testing capacity. If we are increasing the capacity only to meet the demand if ever we move into third stage. No, then I should be mentally prepared. My physical preparation of these testing sites should be always there to ensure that people will have access to testing if we land up there. So preparedness has to be maintained, and that's why we have ramped up capacity. But even now you don't utilize all the